I'm Dr. Michael Thomassen from Nebraska Equine in Omaha, and today I'm going to talk to you a little bit about laminitis. There are few words that can strike as much fear in a horse owner, a veterinarian, or a farrier as laminitis. So laminitis, by definition, is inflammation in the attachment from the coffin bone to the hoof capsule. Sometimes you can just have inflammation and you don't have anything long-term, you just have inflammation. Sometimes you can have inflammation in that attachment and it damages it, and that your coffin bone can either rotate and become closer to the ground or can sink within the hoof capsule. Laminitis is a painful condition in all horses, and I think one of the reasons that it strikes so much fear is that it can be a life-threatening situation. So for humane reasons, sometimes we have to put horses down that develop laminitis. So there are a lot of causes of laminitis in horses and ponies, but one of the biggest drivers is caused by metabolic abnormalities. So the biggest things that we see that will trigger it: obesity and insulin resistance. So by far the most common call with laminitis, we come out and we see a horse that's overweight, and then we do some diagnostics with it and we determine that insulin is far too high. That's the primary driver. And so until you get to the bottom of that through testing, then anything that we do, shoeing, trimming, bedding it deeply in a stall, and anything management-wise with anti-inflammatory medication, that's all kind of just covering the symptoms but not getting into the true cause. So there are other reasons. I mean, concussive forces, so if they're running on a hard surface for a long period of time, or if they have, they're standing on one leg, so the right hind really hurts them for some reason, and they're bearing all the weight on the left hind, that supporting limb can develop laminitis. But by far, the metabolic abnormalities drive most of the laminitis. So getting to the bottom of why the horse or the pony has laminitis is key. Then moving forward with a treatment plan that will include trimming and shoeing and things like that, but also medication and diet and exercise modification to try to help it in the future. So even though it's scary, there are some things that can be done to both, I won't say prevent, but to minimize some of the effects of laminitis, and hopefully in the future with that horse or pony, decrease the likelihood of it happening again.